The month of June shines a spotlight on wound care awareness. An estimated 7 million Americans suffer from some type of wound that won't heal, and not getting the proper treatment could lead to more complications with your health. Joining us now to talk about this is Dr. Zeb Ali, Hartford Healthcare's Medical Director of Advanced Wound and Hyperbaric Medicine, who is out of MidState Medical Center in Meriden. Doctor, welcome.
Thanks for your time today.
Thanks for being here. So what type of wounds are we talking about specifically, and what causes them?
So these aren't your typical cuts and scrapes that are expected to heal by themselves. These are usually the type of wounds that are chronic, meaning that they usually take some time to go away, even with special treatment, and are usually due to some kind of underlying disease process like diabetes, poor circulation, previous history of surgery or radiation.
All right, doctor, what is a reasonable amount of time someone should wait before realizing that a wound won't heal on its own, and what happens if they leave it untreated?
Usually, although there isn't a specific number, I would start to get concerned if a wound hasn't shown signs of healing after approximately 4 weeks. The problem with wounds that stay open longer than this is that they can become prone to infections, increased pain, sometimes bleeding episodes, and ultimately even amputations if it's due to diabetes or circulatory disorder.
All right, talk about how a wound care specialist is able to help.
So wound care is its own specialty. We have special training and special abilities and access to technologies and staff that is also well equipped to heal these wounds. Oftentimes they appear to be rather simple because it's the analogy of judging a book by its cover, but there's oftentimes a lot going on causing the wound to stay open. We're using various procedures such as debridement, which is specialized cleansing of the wound, various wound products, more modern products such as artificial skin substitutes, oxygen therapy known as hyperbaric oxygen. These types of modalities all used together can help heal these more complicated wounds.
Okay, quick last question. How has COVID impacted wound care?
This year, it's been better. When the virus was relatively new and we didn't know a lot about it, a lot of people did stay home and wouldn't come to the wound centers. But due to Hartford Healthcare's strict policies with screening and avoiding congestion and multiple hand hygiene stations, I must say that this year we've seen a lot of people coming back to our wound centers, and our volume has been increasing, especially in light of all the vaccinations that are going on. So
all right.
The impact is getting less.
Thank you, Dr. Zeb Ali. Thanks for joining us.
Great. Thanks for your time.